This program is specifically designed for people suffering with chronic pain, and it is specifically non-cancer pain. So anything other than cancer which is causing chronic pain can they can be benefited by participating in our program. So just to run through the general diagnoses that can be helped, one is chronic musculoskeletal pain, which is very, very common, basically because of sedentary lifestyle and lack of exercise, lack of stretching, stress, irritable bowel syndrome, fibromyalgia, cluster headaches, migraines, chronic lower back pain, arthritis, complex pain syndrome, chronic pelvic pain, pain due to sports injuries. A lot of the times, if there are any athletes in the talk today listening to me, you will know that there are a lot of injuries which happen during practice, during the event, even post the event. And this program will help even for those people who are suffering from sports injuries. Chronic pain post surgery, which is specifically seen after lower back pain surgery, depression associated with chronic pain, anxiety disorder associated with chronic pain, chronic inflammatory conditions, Crohn's disease, ankylosing spondylitis, and chronic fatigue. Now, this list is not exhaustive. As I said, non-cancer pain, any pain which is coming under non-cancer can be benefited from this program. And in this video or in this presentation today, I'll be taking you through the whole concept, like how it came and how we are going to address the problem. So you will also get an idea of how you will be benefited by this. So what are the objectives of this program is, one is to understand the mechanisms of chronic pain, like why does chronic pain happen? Second is to understand the underlying causes that lead to chronic pain. If you just paid attention to the previous slide, I gave you like a list of 15-20 diagnoses. But all of these diagnoses have one thing in common, that is they have chronic pain. That is their presenting symptom, right? So even though the symptom is pain, the underlying causes can be many and they have to be addressed. Integrative approach to address the root cause of the pain, reduce dependency on pain medications, and to improve quality of life. All right, so this is the objectives of the program. And towards the end of the talk, Bala will take you through the different components of it and how we are going to go about it. So now let's understand what is the purpose of pain, right? So first, let me talk about acute pain, and then we will get into chronic pain. So the first necessity of pain is to indicate injury. If we don't have pain, we will not understand that there is some injury to that part and that has to be addressed and that has to be paid attention to. And if you don't pay attention to it, that part can decay, it can get further damaged, it can cause further issues, it can even cause death of that person. So it is a very basic necessity to stay alive that you understand there is an injury that has happened, and pain is the way by which the brain understands that there is injury. The second use of pain is to activate reflexes. So the moment you have pain, it's a very unpleasant sensation. So what is the first thing that you do is to react. You take yourself away from the pain. Like for example, in this photo, the girl is touching the cactus and she experiences pain and she immediately recoils. So this reflex is activated because that pain is inducing a very unpleasant sensation in the brain, and the brain is reacting to the pain, which is very essential. Third is to promote tissue healing. So when pain happens, there are a flood of neurotransmitters, flood of hormones, inflammatory cytokines which come into the picture. And their job is to first get rid of whatever is causing the injury and then slowly start the tissue healing process. So if these inflammatory markers and these cytokines, these white blood cells, platelets don't come in, the tissue healing will not be promoted, right? So pain is the first thing which eventually cascades into these actions in the body. And lastly, to facilitate avoidant behaviors in the future. This is very important. Pain is a learning process of the brain. So if something has generated a sensation which is this unpleasant, you will try to avoid it at all cost in the future so that you don't get hurt again. Now, this can work very well for physical pain. Like, for example, you won't touch the cactus again. All right. Or you will not go and, touch a flame or fire. But when it comes to emotional pain, which we will see that will also cause physical pain, it's not as simple as trying to avoid things. It's much more complicated. But anyway, so this is the purpose of chronic pain. Sorry, acute pain. Now, what happens in chronic pain? Now, the medical sciences have said that chronic pain is a disease and it has no real purpose in our body and it has to be treated. Why? Because it lasts for more than 3 months. Um, and it continues even after the tissue healing process has happened. So, like if you had a fracture, in all possibilities, by 3 to 4 months, the fracture has healed, but the pain sometimes still persists. It interferes with daily living. Anybody who is suffering from pain can understand how debilitating it is if they cannot plan their day. They don't know how this day is going to be, when the pain is going to come, how much pain is it going to give me, what other activities will I be hindered from doing. So it interferes with your daily activity, which is not what we want. And it also makes a person dependent on other people, which causes an emotional baggage as well. It causes mood changes. It can cause depression, suicidal depression in some cases as well. It can cause anxiety. It can cause worry. It can cause fear. So, mood changes. And lastly, it can indicate that there is a chronic inflammation which is going on in the body, which has not been addressed. Right? So, I won't agree completely that chronic pain is useless. The chronic pain in a lot of cases points out to something that has to be corrected in that person. And the unfortunate part is modern medicine does not go and correct the cause, but just tries to put a balm over it. They give painkillers, they give, all those things. They give muscle relaxants, they give anti anxiety medications, they give all of that, but they don't address the cause of the pain. So this is the beef I have. This is the problem I have with today's modern medicine treating pain. They treat the pain as a symptom. They don't consider that pain is, giving us a bigger signal of something which is going on deeper in the body, which has to be addressed. So just a very basic understanding of how pain is communicated in our body, whether it be an injury or an internal pain or an infection or an inflammation, whatever it is, the part that is getting affected, it sends signal to the brain through the spinal cord. It goes to the brain and it gives a signal that there is something that is causing injury in this part. Now, once that has been addressed, either by removing the stimulus, like going away from the thing, or by giving medications and other things to reduce the inflammation, the brain then sends inhibitory signals to stop the pain. Now, this is very important to understand because we are going to talk about a concept in which these inhibitory signals don't work and the pain persists and continues to stay even after the problem has been resolved. All right, so this is a very basic, crude understanding of how pain is managed or communicated to the brain. So, what makes the pain chronic? So, what makes the pain go from acute to chronicity? The first thing to understand here is it could be an intrinsic issue. Like, for example, if somebody is suffering from arthritis, whether it be rheumatoid arthritis, osteoarthritis, or suffering from IBS, they have got an internal inflammation which is going on, which is damaging some organ. It could be the joint, it could be the intestines, it could be the brain. So, something is happening in the body wherein there it's causing an internal damage, and this internal damage is letting the pain persist for a long time. So that is the first reason. Second reason is muscle tightening. Now, anywhere there is pain, the first reaction, it is a very subconscious reaction that your body has, is to tighten the muscles so that it protects the internal organs. Like, for example, if you have a knee pain, all your muscles around the knee are going to get tightened. And this won't even happen consciously. You won't even realize that these muscles are getting tightened. All right. And that is one reason. So there is inflammation and the muscle is getting tightened. But there are other reasons for muscle tightening. For example, if you are a person who has a lot of stress, a lot of anxiety, a lot of worry, and when you actually try to notice, you will notice that you are clenching a lot of your muscles, which is why stress can cause chronic pain. All right. So second reason why the pain is chronic is that there is constant muscle tightening, which is not addressed. And once there is constant muscle tightening, there is going to be pain in that part of the body. Third, very important reason is central sensitization. Now, in the previous slide, I just told you that sometimes the inhibitory signals doesn't work. The brain is not able to stop the inflammation that is going on, stop the pain that is going on. So in this, what happens in people suffering from chronic pain over a long period of time, say 6 months, 1 year, 2 years, the spinal cord as well as the brain undergoes anatomical and physiological changes, wherein the pain just persists. So unless the central sensitization is corrected, and we're going to see how we can do that, that pain is never going to go. What amount of medications you take, whatever you do lifestyle changes, you do this, you do that, it's not going to go, because the brain and spinal cord have changed the way they function, right? And this happens very, very commonly with a lot of conditions, and especially irritable bowel syndrome, fibromyalgia, depression and anxiety associated chronic pain, as well as post operative pain and sports injuries. So this happens very commonly in these conditions, so they have to be addressed. And lastly, psychosocial. Now, pain is something which debilitates a person and brings in a lot of fear. The first fear that a person gets it, am I going to die? Or am I going to suffer like this for the rest of my life? So these are the questions that keep running over and over again in people's mind when they suffer from pain. And this fear, this fear of unknown, fear of the future, fear of what is going to happen, can lead to psychosocial pain, wherein the pain is magnified because of anxiety. Okay. So, what happens? How does that happen? So, let's say, for example, if you have lower back pain, the first thing you're going to do is have less movement. You will try to give it less stress, not bend over too much, not sit down, take all the precautions, and slowly slowly when you're doing less and less movements, you're putting fear in yourself that, oh my god, if I'm sitting in this rickshaw is going to bump and I'm going to feel pain. There is it, the anxiety has come. Your pain has already started even before you have stepped into the rickshaw. And then slowly slowly, as I said, brain changes and nerve changes take place, where your brain and your brain tries to look for signs that what is going to increase my pain. It's going to become hypersensitive. All right. And once that happens, it's going to further increase the pain. So this is a pain fear cycle which maintains the chronicity of the pain, which has to be corrected. Okay. So how do you do an integrative approach to chronic pain? The first step to that is to identify the cause. As I said, the pain is only a symptom, the cause can be multiple. So we have to identify and treat the cause properly. So I'm going to just go through some of the causes of pain, general causes, and as a part of the program, we are going to keep some presentations as well. And in those, I'll be going into detail about the causes of pain. So the first cause is autoimmunity. So which, if you are suffering from any autoimmune condition, psoriasis, lichen planus, arthritis, rheumatoid arthritis, fibromyalgia, SLE, whatever be it, even Hashimoto's thyroiditis, there is a constant inflammation going on in the body in different places. And this can maintain the pain. So the autoimmunity has to be corrected if autoimmune is the cause for the pain. Second thing is food. Now, food recently, in the last 10 to 15 years, there has been so much research on gut health. And we understand there is something called as food sensitivity, which is very different from food allergy. So a person may not present with vomiting, nausea, and loose motions after eating something, but they can present with increased pain. I have a patient of psoriatic arthritis who told me, I have observed whenever I eat wheat products and maida products, my arthritis and psoriasis flares up. This is an observation which he has made. I did not even ask him about these things. He told me these things. So people are very sensitive. And when you ask them, they understand that they have realized that a lot of common food items can trigger their pain. Third, posture or injury. As I said, post sports injury, any injury actually, the pain can persist. And posture is another very important thing, because we are living a life where we are very sedentary. We are working, sitting in one place, looking at the screen. So ergonomics is a huge thing, which a lot of these corporates have taken up, but it's not enough, and it is causing a lot of pain in a lot of people. Fourth is metabolic. So metabolic is basically people who are suffering from hormonal imbalances, especially diabetics, as well as PCOS. So these are the two main conditions where we see a lot of pain. So anybody who is diabetic knows that diabetic neuropathy is a big problem. It causes a lot of pain, lot of burning sensation, unable to walk, and lot of discomfort to the person. Stress, as I said, when somebody is stressed, they automatically tense up without even understanding that they are tensing up. So stress is one of the main causes of it. Stress leads to a lot of things, lot of other diagnoses which can cause pain. That is one way. Second way, stress directly causing musculoskeletal issues. Endocrine disruptors. Now this is a huge topic to discuss, but just to glance over it, endocrine disruptors are certain chemicals specially found in plastics like BPA and bisphenol, which can mimic hormones and cause hormonal imbalances in women, mainly in women, but it also causes in men sometimes. So these endocrine disruptors lead to inflammation, lead to gut, bad gut health, bad hormonal balance, and eventually can lead to pain. And heavy metals. Now we are unfortunately living in a very polluted environment, and we are being exposed to lead, arsenic, so many metals that we don't even know. And which is why heavy metal detox is another therapy which actually works for some of the patients, uh, especially if we know the link. Like if we understand, for example, they have found out that people suffering from heart disease usually have lead toxicity and cadmium toxicity. So when you understand that these heavy metals directly cause these links, so you can do a detox therapy to flush out these metals from the body, and the patient actually starts feeling better after the process, right? So these are some very broad uh, causes for chronic pain, right? So now going further, what is the second step? So now we identified the cause. Now, what do you know next for the cause? So obviously, we'll try to work on the cause. So we'll try to reduce the inflammation. For example, if it's an autoimmune condition, we try to reverse it, reduce the autoimmunity. If it is related to sports injury, we do things for that. Like as I said, if we understand that it is because of heavy metal toxicity, we try to detox the heavy metals. So, what are the things that I will be doing as part of this program? That which is what I'm going to discuss mainly. One is homeopathy. Works very well in many conditions. I have used it successfully in a lot of chronic pain patients, and it works at par with allopathic medications or modern medicine sometimes. And they can taper down their painkillers and all that, because painkillers do cause a lot of harm in the long run. The second tool which I use is medical cannabis. I have had a talk with Reach itself a couple of weeks back, so you can go there, access the talk on their YouTube channel and see the details. But I do use a lot of medical cannabis for chronic pain patients, and the results are really very good. The third tool that we're going to offer is yoga and Yog Nidra. So Yog Nidra, which Swati is going to take up in the second half of this presentation, so I'm not going too much into it. Fourth is an anti-inflammatory diet. So as I said, food is a very big component of autoimmunity as well as chronic pain as well as gut health. So anti-inflammatory diet becomes a cornerstone or center stone for treating chronic pain, which will also be discussed when you do the one-on-one consultations with me. Next is to address sleep issues. It's very surprising to see that a lot of people with chronic pain have sleep problems. And what is even more surprising is that it's not the pain is causing sleeplessness, but the sleeplessness started even before the pain began. So reduced sleep increases cortisol levels. It decreases the repair mechanisms in the brain. It causes reduction in the parasympathetic nervous system, causes so many changes, hormonal changes in the body, which can finally lead to chronic pain. So sleep in itself has to be addressed when we are addressing pain. Herbs, there are like, so herbal medicine is a huge thing. So in India we have Ayurveda, there is traditional Chinese medicine, there is African herbs, there are American herbs, there are so many herbs that are available. And it's the materia medica of herbal medicine is huge. But there are some herbs which are commonly available in India, which are very anti-inflammatory, which can be used for specific, reasons, specific diagnosis, like for arthritis or for psoriasis, etc. So those herbs, when you integrate it with your treatment plan, it gives immense benefits. And lastly, anti-inflammatory lifestyle. So most of the diseases we see today are because of wrong lifestyle. So we have too much stress, we work too much, we don't sleep enough, we don't relax enough, we don't unwind. So all these things contribute to our condition that we have today. So it has to be addressed in a very holistic manner. There is no way that one pill can cure every ill. It's not going to happen. So it has to be a very integrative approach. Different modalities have to be integrated uh, at the same time to actually see the benefit. All right. The third thing that you can do, that you have to do in chronic pain, is learn to relax your muscles. So as I said, muscle tensing is one of the main reasons for why pain persists. So learning to relax the muscles is very important. This can be done in many ways. You can do acupuncture, and whatever medicines also I said, like cannabis, homeopathy, herbal medicine also helps with muscle relaxation. But other than that, what you can do is acupuncture, massage, regularly doing yoga, as well as any physical activity for that matter, cold showers and hot packs. So these are the certain external modalities that you could do that can help you with the pain. And lastly, retrain the brain as well as the pain pathways. Now, this is very important. As I said, central sensitization, wherein your brain and the spinal cord undergoes permanent changes, causing this pain to persist even after the inflammation has gone, even after the fracture has healed. So you have to retrain the brain to not feel the pain. That is a very important aspect of chronic pain management. So there is a saying that neurons that fire together wire together, right? So if your brain has associated, for example, it has associated evening, like the sunset, with pain, every night, every evening when the sun sets, you are going to experience pain because your brain has associated that. So you have to disassociate these kind of associations which the brain has formed, and it's not easy, but it is definitely doable, right? And in the next section, Swati will talk more about how we can manage this rewiring and restructuring of the brain, which is a big part of our program. All right. Thank you so much. And I'm going to hand over the presentation to Swati now so that she can continue the last part of the program.